They're working on it. That's it. I see it.
Chairman, we are ready to begin.
Well, good morning to Lauren. If you will conduct the roll call of board members, please.
Yes, Chairman. I will begin with Roger Folsom,
Here.
Tommy Hopkins,
Here.
Kathleen Ruth,
Here.
Norman Boyd,
Here.
Robert Coles, David Cruz,
Here.
Shane Mobley,
Here.
Cynthia Rucker,
Here, can you hear me? Here?
Yes, we can hear you.
Thank you.
Anthony Williamson.
Here.
Chairman, that completes my roll call.
Thank you, DeLauren. We certainly have a quorum, so we call the meeting to order. Good morning, everyone. Here we are in summer, right on it. We have a pretty healthy agenda this morning, so I won't belabor the point, but we will have the approval of the minutes from May 14th, and I would ask Board Secretary Kathleen Ruth if she's had an opportunity to review those minutes, and if so, would move to accept those.
Yes, Mr. Chairman, I have reviewed the minutes for May 14th and motion for approval.
I have a motion for approval of the May 14th minutes. Do we have any discussion or anything that we need to do? Corrections? Do we have a second?
Second, Hopkins.
We have a motion and a second for approval. All those in favor of the motion signify by aye.
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 Opposed, no. Minutes are approved. Thank you. No real opening comments this morning other than what I just iterated. We do have a healthy agenda today. This board's up to the task. I'm well aware of that. So we have some multiple items for initial and final adoption. We have a couple of presentations at the end that Louis Amos is going to ask us to act on the rates for the state health benefit plan, and we'll have that discussion at the end of the agenda. We'll move on. I know that earlier this morning, the audit committee conducted a meeting, and Chairman David Cruz, I would ask if you'd give us an update on that meeting.
Thank you, Mr. Chairman. The audit committee did meet this morning and discussed a number of items. The first item on the agenda was the audit committee's charter review. That was in the packet for the board members, everybody to see that, and we did review our audit committee charter without any changes. We also heard from Joe Hood, Chief Compliance Officer, about a RFI that's been issued by the Department's Office of Inspector General. This RFI is in compliance with the federal government's emphasis on fraud, waste, and abuse. This is an opportunity for the department to try to obtain additional tools for its toolbox as it continues its programs focused on stopping fraud, waste, and abuse. This is just an enhanced effort that is going to be made once the responses come in for the RFI. The department will move forward with that. We also heard from David Chong, who is the Deputy Inspector General, on the status of 4 current and 1 state audit that's currently going on. And then, of course, the 1 state audit is the annual comprehensive annual audit that's done by the state auditor's office, the Department of Audits and Accounts. This is the annual comprehensive financial report and single audit for the year that's ending June 30th. That audit is underway along with 4 federal audits. David Chong also reported on completed audits. There were 6 completed audits by the state and 1 by the federal government. David went through the audit findings as well as the department's efforts to address those findings. We ended with a report from David about an audit enforcement and risk oversight initiative that's going on by the federal government as well. We had a good meeting, good response. I think all of our questions were addressed. So that completes my report, Mr. Chairman.
Thank you, David. Any board members have any questions for David and the committee? Okay, again, thank you for that. We'll move on to the commissioner's report now. Dr. Burt.
Morning, Mr. Chairman and members of the committee, members of the staff. I am taking this meeting from South Georgia today. I came home to vote and encourage everyone to participate in that process. It's extremely important to our way of life to make sure everybody takes up their given rights to let their voice be heard. Just when we thought the coast was clear and the General Assembly was at home, we hear they're coming back for a special session, I think next week. It is going to focus on some things that are not healthcare related, but the department stands ready to respond to questions and deal with issues that may come up because they're back in town. So we'll keep y'all posted if anything happens there of note from our department. Just a quick update on the Rural Health Transformation Program. We do have funding opportunities. Our first 2 rounds are out. Round 3 is about to close the application period on June the 15th. And then we'll start a lot of competitive grants that were not named specifically in the application beginning on June 15th. CMS is expecting us to try to get this first year's grant funding out before the end of the federal fiscal year and the end of October, and the state is doing its best to make sure we follow all the guidelines and try to get the money out to those that need it as quickly as possible. I want to thank our dedicated staff for all the hours and work that they've done to try to make sure that this program runs as well as possible. There will be a webinar today talking about the Great Health Program at 3 p.m. And that information is available on our website for anyone that wants to tune in. And we'll be going over some of the timeline and information. Another issue that we've been talking about at every meeting is our directed payment program. We will be sending the next year's preprints, as we call them, which is basically the outline of the program for CMS to review and approve. Those will be going up shortly, and hopefully, unlike last year, we'll get a response from them. Since there's really nothing new this year in them, we'll get a response a little quicker. Last year, it took about 8 to 9 months before we got the approval on those, but I'm expecting that process to be much smoother this year. Also, other information about HR1, which is where the Rural Health Transformation Grant was born, but there were a lot of other changes in Medicaid in particular, and we are working on how that affects Georgia and how it interacts with our Pathways program, which is the program that we had in Medicaid that had work requirements. There are some similarities to the new law with HR1, but they're not identical, and we're working really hard to align those things up and get the OPB and the governor's office up to date on what our likely enrollment will be and what fiscal implications it may have on the state. Finally, the SHBP PBM, as we've reported the last couple of months, we have a new vendor that we are onboarding to go live first of the year. That's Express Scripts, and our team is meeting with them weekly, and they report that the progress is going very well, integrating this new vendor and their systems with ours, and hopefully we won't have any hiccups as we switch to a new vendor after we've spent, I guess, at least 6-7 years with the current vendor. So this will be a change. That's all I have to report today, Mr. Chairman, members of the committee. I want to congratulate our employee on milestones, but I'll be glad to answer any questions before I do that, if there are any.
Any board members have questions for the commissioner? Okay, proceed on, Commissioner.
Thank you, Mr. Chairman. First, we have Tashandra Corbin at the Office of Technology at 25 years. Also at 25 years is Gwanis Fleming at SHBP. We have one at 20 years, Danita Wesson at Medical Assistance Plan. We have one of 10 years at Office of Information and Technology, Takasha Hurley. We have 2 5-year celebrations, Sonia Brown at the Office of Health Planning and Louis Amos at the State Health Benefit Plan, which we'll hear from him a little later. Celebrating 1 year with the department is Brianna Nunes in the Commissioner's Office, Jessica Liang at Office of Analytics, Kita Shimizu at Office of Analytics, Ty Chambers, CMO Performance Management, Anelia Davis, Medical Assistance Plan, Shalili Mitetwa, Healthcare Facility Regulation, and Dana Esco at Healthcare Facility Regulation. So we want to thank all those employees and celebrate their milestones and dedication to public service. With that, Mr. Chairman, I'll turn the program back to you.
Thank you, Commissioner. Now, on behalf of the board, we certainly want to echo those employee milestones and appreciate each one of you individually for your dedication and commitment to the state of Georgia. We'll move into our workload now, and the first item we'll consider for a final adoption will be alignment with the Centers for Medicare and Medicaid Services School-Based Services Guidance Public Notice. And our Senior Policy Advisor, Emily Hatchett, will be presenting to us this morning. Good morning, Emily.
Good morning, Chairman Folsom, Commissioner Burke, and members of the board. My name is Emily Hatchett, and I serve as Senior Advisor to the Medicaid Director within the Medical Assistance Plans Division here at the Department of Community Health. Today, I'm presenting to you the public notice to align Georgia's school-based services with CMS guidance. The department seeks your favorable consideration for final adoption, retroactive to May 15th, 2026, pending CMS and final board approval. The Department of Community Health will submit updates to Georgia's Medicaid state plan and to the Administrative Claiming for Education implementation materials to align with the federal school-based services guidance. Updates clarify covered services and administrative claiming, modernize random moment time sampling parameters and cost reconciliation timelines, and strengthen documentation and oversight without changing member eligibility or benefits. The goal is to simplify local education agency participation, ensure fiscal integrity, and support sustainable federal reimbursement for for services delivered in schools. There is no fiscal impact for these changes as they are administrative in nature to comply with CMS guidance and support streamlined participation for local education agencies. A public notice hearing was held on May 20th, 2026 at 11:30 a.m. via Zoom audio, and written comments were accepted through May 27th, 2026. The department received no comments at this time. So today I am requesting the board's final adoption of the proposed changes for Georgia's school-based services, retroactive to May 15th, and I'm happy to answer any questions you may have.
Any questions from board members for Emily? Hearing none, is there a motion for final adoption?
Shane Mobley moves.
Shane Mobley has moved for final adoption. Is there a second?
Second, Cynthia Rucker.
Cynthia Rucker has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Opposed, no. Anyone abstaining? Motion passes. Thank you, Emily, for your presentation.
Thank you, Chairman Folsom.
Next item to consider for final adoption is changes to the disproportionate share payments allocation methodology. And our Chief Operating Officer, Joe Hood, will present this to us. Good morning, Joe.
Good morning. Good morning, Commissioner, Mr. Chairman, and board members. My name is Joe Hood, and I'm the Chief Operating Officer for the Department of Community Health. This morning, I'm presenting for final adoption changes to the disproportionate share hospital payments, or DSH payments. Prior to adoption of the Health Improvement Directed Payment preprint, the majority of hospitals qualified for a DSH payment, which is an annual allotment of federal funds to supplement payment to hospitals for services provided to Medicaid patients and the uninsured, basically to cover the gap between the cost of providing those services that is not covered through the initial reimbursement. However, the addition of the HIP-directed payment added Medicaid payments received to the hospitals above most hospitals' hospital-specific limit that qualifies them for a DSH payment. Therefore, this policy change removes the 75% cap the department previously had in place on larger system hospitals in Pool 2 to allow each hospital which has not met its hospital-specific limit to receive the maximum amount of DSH funds and minimize the amount of unallocated DSH funds that would remain with the state. An opportunity for public comment was held on May 21st, 2026 at 11:30 a.m. There were no oral comments and only one written comment received. Brian Lipton, Vice President of Healthcare Finance for the Georgia Hospital Association, commented in support on behalf of the association's 150 hospital members. The commenter stated the changes promote effective use of federally allocated DSH funding within existing federal constraints. He further stated that this allows the redistribution of remaining unallocated DSH funds, which helps ensure the available resources are utilized by eligible hospitals to the greatest extent possible. The department thanks and appreciates the support of the Georgia Hospital Association and its members of this proposed change. If there are no questions, Mr. Chairman, I would ask the board to have favorable consideration for the final adoption of this change, but happy to answer any questions.
Any questions for Joe from board members? Hearing none, we'll entertain a motion for final adoption.
So moved, Kathleen Roof.
Kathleen Roof has moved for final adoption. Is there a second?
Second, Cynthia Rucker.
Cynthia Rucker has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion passes. Thank you, Joe, for your presentation.
Thank you.
Next item we'll consider for final adoption is the rules and regulations for nursing homes. That'll be presented to us by Patrick Long, Associate General Counsel. Good morning, Patrick.
Good morning, Chairman Folsom, Commissioner Burke, and members of the board. The Division of Healthcare Facility Regulation presents rules today for final adoption for nursing homes. These rules are found in Chapter 111-8-56 of the Department's Rules and Regulations. These rules will address two issues with the revisions. First, the changes add a cross-reference to the existing rules and regulations for criminal background checks found in Chapter 111-8-12, so that all requirements associated with criminal background checks for owners, administrators, and direct care staff are contained within those designated rules, and there are no substantive changes being made to the requirements themselves. The second change is to update the requirements for health screenings for nursing home employees, including screening for tuberculosis. The revised TB language aligns with the recommendations for the Centers for Disease Control and Prevention. A public comment hearing was held via audio Zoom on May 5th, 2026 at 1:30, with written comments to be accepted on or before May 7th of 2026 at 5 p.m. There were no oral or written comments received. And at this time, we would respectfully request consideration today for final adoption of these rule changes, and I'm happy to answer any questions.
Any questions for Patrick from board members? Hearing none, we'll entertain a motion for final adoption.
Motion for final adoption, David Cruz.
David Cruz has moved for final adoption. Is there a second?
Shane Mobley, a second.
Shane Mobley has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Patrick will proceed on to the rules and regulations for intermediate care homes.
Thank you, Chairman. The Division of Healthcare Facility Regulation also presents rules today for final adoption for intermediate care homes. These rules are found under Chapter 111-8-47 of Department Rule and Regulation. These rule revisions are substantially similar to the revisions for nursing homes. A public comment hearing was held via audio Zoom on May 5th, 2026 at 11:30 a.m. with written comments due on or before May 7th, 2026 at 5 p.m. And there were no oral or written comments received by the department. So at this time, we would respectfully request consideration today for final adoption of these rule changes, and I'm happy to answer any questions.
Are there any questions for Patrick regarding this item? Hearing none, is there a motion for final adoption?
Shane Mobley motions.
Shane Mobley has moved for final adoption. Is there a second?
Second, Kathleen Roof.
Kathleen Roof has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. And Patrick, we'll move on to your final item, the end-stage renal disease facilities rules and regulations.
Thank you, Chairman. The Division of Healthcare Facility Regulation presents rules today for initial adoption for end-stage renal disease facilities, or ESRD. These rules are found in Chapter 111-8-22 of the Department's Rules and Regulations. These rule revisions will update the requirements for health screenings for ESRD employees, including screening for tuberculosis, and the revised TB language aligns with the recommendations of the CDC. A public comment hearing will be held via audio Zoom on July 14th, 2026 at 1 p.m. Written comments will be accepted on or before July 16th, 2026 at 5 p.m. And at this time, we would respectfully request consideration today for initial adoption of these rule changes, and I'm happy to answer any questions.
Any questions for Patrick regarding this item? Hearing none, is there a motion for initial adoption?
Motion for initial adoption, David Cruz.
David Cruz has moved for initial adoption. Is there a second?
Norm Boyd seconds.
Norm Boyd has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Or anyone abstaining? Motion carries. Patrick, thank you for your presentations this morning.
Thank you very much, Chairman.
Next item we'll consider for initial adoption is the Children's Health Insurance Program Health Services Initiative, and that will be presented to us by Joe Hood, our Chief Operating Officer again. Good morning again, Joe.
Good morning, Mr. Chairman. Thank you. Again, my name is Joe Hood. I'm the Chief Operating Officer for the department. And this morning, I'm presenting for initial adoption the Children Health Insurance Program, or CHIP Health Services Initiative for initial adoption. A health services initiative under the CHIP, or as we call it, Peach Care for Kids, allows the state to request funding through a state plan amendment to use unspent CHIP administrative dollars to address unmet needs of low-income and Medicaid-eligible children. In this state plan amendment, the state is proposing a phase-in of an initiative to assist the state's compliance with early and periodic screening, diagnostic, and treatment of children who present in juvenile court for various circumstances. Presently, there is not a consistent process or funding to assess children's EPSDT needs and provide treatment and case management when they present in a juvenile court setting as a child in need of services or for a lower level criminal offense. This proposal will provide grant funding to juvenile courts in a phased-in manner to address the need. It will also assist the state in meeting its requirements, its mandated requirements for Medicaid EPSDT and its justice-involved youth mandate. The funding will initially be phased in 3 judicial circuits: the Cobb Judicial Circuit, the Douglas Judicial Circuit, and the Middle Judicial Circuit, through grants from the Criminal Justice Coordinating Council, which the department will partner with, who administer other federal and state grants to juvenile courts for other similar purposes. These circuits represent different populations and can likely be replicated in the process and policy in the next phases of an eventual statewide implementation to meet the overall mandates. The initial cost for the state fiscal year 2026, which is allowed to be retroactive if adopted and approved by CMS, is a total of $183,976 to cover the development of the Health Services Initiative and its components parts to this point. The state fiscal year 2027 covers assessments and services primarily for a total annual cost estimated at $26,877,898. That's primarily in the juvenile courts themselves through the grant process. An opportunity for public comment will be held on June 16th, 2026 at 11 a.m. via Zoom. Written comments will be accepted as stated in the public notice by the department on and until June 23rd, 2026. If there are no questions, I would ask for favorable initial adoption of this state plan amendment. Thank you, Mr. Chairman. Happy to answer questions.
Any questions from board members for Joe? Hearing none, is there a motion for initial adoption?
Shane Mobley, adopt.
Shane Mobley's made a motion for initial adoption. Is there a second?
Second, Williamson.
Anthony Williamson has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Joe, we'll move into your second item, which is the state plan amendment modification to rural newborn delivery program.
Thank you, Mr. Chairman. This presentation is to provide a modification to the Rural Hospital Newborn Delivery Program State Plan Amendment under Medicaid. Pursuant to the state fiscal year 2027 Appropriations House Bill 947 in line item 1216, which passed during the 2026 legislative session and pending approval by the Centers for Medicare and Medicaid, the department proposes to modify the Medicaid state plan by discontinuing the designation for the Rural Hospital Newborn Delivery Program for hospitals in rural counties with a population between 35,001 and 50,000. Under the current Medicaid state plan, hospitals in this category receive an enhanced payment of $1,500 per newborn delivery. Effective July 1st, 2026, the department is seeking approval to remove the separate program designation. However, the enhanced add-on payment for newborn deliveries in rural counties with populations of 35,000 or less will remain. This will have a state funds savings impact in state fiscal year 2027 per the appropriations bill referenced of $2,165,425 and a total fund savings of $6,477,975. An opportunity for public comment will be held on June 16, 2026 at 10:30 a.m. via Zoom. As provided in public notice, written comments will be accepted by the department on or before June 23, 2026. If there are no questions, Mr. Chairman, I would ask for favorable initial adoption of this state plan amendment.
Are there any questions for Joe? We'll entertain a motion for initial adoption.
Norm Boyd, so move.
Norm Boyd is moved for initial adoption. Is there a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Any opposed, no. Anyone abstaining? Motion carries. Joe, thank you for your presentations.
Thank you, Mr. Chairman.
Next item we will consider for initial adoption is the clarification of language for reimbursement for outpatient clinical diagnostic laboratory services. And Emily Hatchett, our Senior Policy Advisor, will present that to us.
Good morning again, Chairman Folsom, Commissioner Burke, and members of the board. Emily Hatchett with the Medical Assistance Plans Division. The item I bring to you now is the state plan amendment to modify the language for reimbursement of outpatient clinical diagnostic laboratory services. Pending approval by the board and the Centers for Medicare and Medicaid Services, DCH seeks to clarify the language within the state plan concerning reimbursement for outpatient clinical diagnostic laboratory services. As directed by the U.S. Department of Health and Human Services in response to an audit, the state plan will be updated to amend the language on reimbursement of outpatient clinical diagnostic lab services. These services will be reimbursed at 80% of the Medicare lab CAHABA, which is also known as the Medicare Clinical Lab Fee Schedule rate. This clarification is intended to ensure consistency, transparency, and alignment with established reimbursement methodologies. This change will result in a savings of approximately $200,000 in state funds and $400,000 in federal funds for a total savings of approximately $600,000. Pending board and CMS approval, this change will be effective June 12th, 2026. A public hearing is scheduled for June 17th at 10:30 a.m. via Zoom audio, and written comments will be accepted on or before June 24th, 2026. Additional information can be found in the public notice published on the DCH website. So this morning, I'm requesting the board's initial adoption of the state plan amendment to clarify the language for reimbursement of outpatient clinical diagnostic lab services, and I'm happy to answer any questions you may have.
Any questions for Emily regarding this item? Hearing none, we'll entertain a motion for initial adoption.
Hopkins, so move.
Dr. Hopkins has made a motion for initial adoption. Do we hear a second?
Second, Cynthia Rucker.
Cynthia Rucker has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Opposed, no. Anyone abstaining? Motion carries. Emily, we'll proceed on with your next item, clarification of language for reimbursement for independent laboratory services.
Thank you, Chairman Folsom. So the final item that I bring to the board today is a state plan amendment to modify the language for reimbursement of independent laboratory services. Pending approval by CMS and the board, DCH seeks to clarify the language within the state plan concerning reimbursement for independent lab services. Once again, as directed by the U.S. Department of Health and Human Services in response to an audit, the state plan will be updated to amend the language on reimbursement for independent lab services. These services will be reimbursed at 80% of the Medicare lab CAHABA or Medicare clinical lab fee schedule rate. This clarification is intended to ensure consistency, transparency, and alignment with established reimbursement methodologies. The change will result in a savings of approximately $1.2 million in state funds, $2.4 million in federal funds, for a total savings of around $3.6 million. Pending board and CMS approval, this change will be effective June 12th, 2026. A public hearing is scheduled for June 17th at 11:30 a.m. via Zoom audio, and written comments will be accepted on or before June 24th, 2026. Additional information can also be found in the public notice published on the DCH website. So this morning, I am now requesting the board's initial adoption of the state plan amendment to clarify the language for reimbursement of independent laboratory services. And I'm happy to answer any questions you may have.
Any questions for Emily? Hearing none, we'll entertain a motion for initial adoption.
So move, Kathleen Ruth.
Kathleen Ruth has moved for initial adoption. Is there a second?
Second, Williamson.
Anthony Williamson has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
Aye.
Opposed, no. Anyone abstaining? Motion carries. Emily, thank you for your presentations.
Thank you, Chairman Folsom.
Next item is the Teachers Plan Employer Contribution Rates and Public School Employee Plan Employer Contribution Rates. And Louis Amos, who's Executive Director of the State Health Benefit Plans, will present this to us. Good morning, Louis, and congratulations on your employee milestone.
Thank you so much, Chairman Folsom, Commissioner Dr. Burke, members of the board. Louis Amos, Executive Director for the State Health Benefit Plan. And I'm going to present a resolution today that will address the State Health Benefit Plan, Teachers Plan, Employer Contribution, and the Public School Employees Plan, Employer Contribution. I'd like to remind the board that we addressed the state agency's employer contribution during the April meeting. We will provide the board the recommendations for the 2027 benefit plan year retiree and employee rates during the August board meeting. And I'll read the resolution. Whereas the state health benefit plan is comprised of 3 health insurance plans supported by its own fund, the state employee plan, which is this for the state employees, a plan for teachers, the teachers plan, and a plan for public school employees who are not eligible for the plan for teachers. Whereas the commissioner of the Department of Community Health is permitted to combine the funds supporting the 3 plans, the state health benefit plan, in order to pay benefits and do under any of the plans. Whereas SHBP regulation provides that the board shall establish by resolution, subject to governor's approval, employee contribution rates. These rates may be a dollar amount for each member a dollar amount for each member enrolled, a percentage of member salary, or any other method permitted by law. Whereas the employee contribution rates are reviewed and revised annually in accordance with SHBP's regulation. Whereas the Appropriation Act for fiscal year 2027 maintains the employee contribution for teachers, and whereas the board wishes to establish the fiscal 2027 annualized teacher employee contribution rate as a monthly amount of $1,935 for each library employee enrolled in the teacher's plan and continuing until changed by board resolution. Whereas the board wishes to establish the fiscal 2027 annualized teacher employer contribution rate as a monthly amount of $1,935 for each non-library employee enrolled in the teacher's plan, continuing until changed by the board resolution. Whereas the board wishes to establish the public school employees plan employer contribution at a monthly rate of $1,935, continuing until changed by the board resolution in order to support ongoing financial stability of SHBP. Whereas Georgia law requires that the effective employees must be notified by other changes of employee contribution for the changes taking effect. Now, let it be ordered that the fiscal year 2027 annualized employee contribution rate shall be the amount of $1,935 for each library and employee enrolled in the teacher's plan and continuing until the board resolution. Now, therefore, let it be ordered that the fiscal year 2027 annualized teachers plan employer contribution shall be the amount of $1,935 for each non-library employee enrolled in the teacher's plan and continuing until changed by board resolution. Now, let it be ordered that the public school employee plan's employer contribution shall be a monthly amount of $1,935 and continuing until changed, by board resolution in order to support the ongoing financial stability of SHBP. Now, let it therefore be ordered that the commissioner shall take all action to ensure that employers required to pay the teacher's plan employee contribution and public school plan employee contribution receive proper and timely notification of all required contribution rates. Resolved this 11th day of June, 2026 in public session. I respectfully ask approval and now will entertain any questions that the board may have.
Any questions for board members for Lewis? As stated, the board is asked to approve this resolution, so we'll entertain a motion for approval.
Hopkins, so moved.
Dr. Tommy Hopkins has made a motion for approval. Is there a second?
Second, David Cruz.
David Cruz has seconded the motion. Any further discussion? Hearing none, all those in favor of the motion signify by aye.
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 Opposed, no. Anyone abstaining? Motion is approved. Lewis, thank you for your presentation.
And thank the board for your support.
Next presentation we will entertain this morning is CMS long stay quality measures utilized during calendar year 2027 to determine the supplemental quality of incentive payments made to eligible nursing facilities in SFY 2028. And Lynette Rhodes, our Chief Health Policy Office, will present to us. That was a mouthful, Lynette. Good morning.
Yes, it is, sir. Good morning, Chairman, Commissioner Burke, members of the board. As always, thank you for the opportunity to present. So the Department of Community Health is updating the Centers for Medicare and Medicaid Services long stay quality measures that will be utilized to determine the amount of the supplemental quality incentive payment made to eligible nursing facilities during state fiscal year 2028. Incentive payments will only be made to eligible nursing facilities that demonstrate improvement in the quality of care rendered to their Medicaid beneficiaries. This change in the quality measures will not impact the funding allotted for the eligible nursing facilities, which will remain as follows. For state fiscal year 2027, the state funds portion represents $12 million. The federal funds portion represents $24,253,776. And the total funds is $36,253,776. The following CMS long stay quality measures will be utilized during calendar year 2027. Nursing facilities that demonstrate improvement in one or more of the following categories will be eligible for a supplemental payment. So the 4 quality measures are as follows. The first is residents who lose too much weight. The second is residents with a urinary tract infection. The third is residents who have received an antipsychotic medication. And the fourth is residents experiencing 1 or more falls with major injury. So those will be the 4 measures that will be utilized during calendar year 2027. The supplemental payment will be based on each nursing facility's overall ranking in each CMS long stay quality measure, resulting in that nursing facility receiving a payment proportional to its improvement. Supplemental payments will be distributed once per year. The base year will be adjusted annually to reflect improvement against the prior year. So for example, calendar year 2026 is paid out against improvement from calendar year 2025. And calendar year 2027 will be paid out against improvement from calendar year 2026. Only those facilities with 50% or more Medicaid long-term residents are eligible. An opportunity for public comment will be held on June 16th at 11:30 a.m. via Zoom. And individuals wishing to comment in writing must do so on or before June the 23rd of 2026. As a reminder, this notice is informational only. No vote is required by the board. And just as a reminder, this DCH board did grant approval for the department to revise these quality measures on an annual basis back in September of 2024. And CMS has also approved that approach. So I'll pause now for any questions.
Any questions for Lynette from board members? Well, if not, we'll move on to your next item, Lynette, which is revised CMS long stay quality measures utilized to determine the supplemental incentive payment made to eligible nursing facilities in SFY 2026.
Okay. Thank you again, Chairman. So the Department of Community Health is revising its methodology utilized to determine the supplemental quality incentive payment made to eligible nursing facilities, again, during state fiscal year 2026. So it is important to note here that this change in methodology is going to impact the payment that will be issued literally in the upcoming weeks. So this will be done, this payment will be made before the end of the month of June. Incentive payments will be made to eligible nursing facilities that demonstrate improvement in the quality of care rendered to their Medicaid beneficiaries. Additionally, the department is increasing the funding that is allocated to the Supplemental Quality Incentive Program for state fiscal year 2026. And this is done in accordance with the amended state fiscal year 2026 appropriations bill. And that is House Bill 973, in case anyone wants to look that up later. The new funding amount for state fiscal year 2026 is as follows. State funds represent $15 million. The federal funds represent $28,771,848. So the total funds for state fiscal year 2026 represent $43,771,848. $771,848. Previously, the department identified 4 CMS long-stay quality measures that would be utilized to determine the supplemental quality incentive payment. The 4 quality measures identified are as follows. The first is the percentage of long-stay residents who lose too much weight. The second is the percentage of long-stay residents with a urinary tract infection. Third is the percentage of long-stay residents who received antipsychotic medication. And fourth is the percentage of long-stay residents experiencing 1 or more falls with major injury. Due to recent changes made by the Centers for Medicare and Medicaid, 2 of the measures that I just mentioned have been impacted. The 2 impacted measures are the percent of long-stay residents experiencing 1 or more falls with major injury, and the second measure that has been impacted is the percentage of long-stay residents who received an antipsychotic medication. As a result of the changes made by CMS, DCH is revising its methodology. For the falls with major injury quality measure, DCH will compare quarter 1 through quarter 3 of calendar year 2024 to quarter 1 through quarter 3 of calendar year 2025. For the antipsychotic medication quality measure, DCH will compare the fourth quarter of calendar year 2024 to the average of all 4 quarters of 2025. There are no changes with respect to the remaining 2 measures. Again, as previously stated, the supplemental payment will be based on each nursing facility's overall ranking for each of the CMS long-stay quality measures. The facility will receive a payment proportional to its improvements. Again, the payment is only issued once per year, and the base year will be adjusted annually to reflect improvement against the prior year. And again, this only applies to those facilities with 50% or more Medicaid long-term residents. An opportunity for public comment will be held on June 17th at 11:30 a.m. via Zoom. And individuals wishing to comment in writing must do so on or before June the 24th of 2026. Again, this notice is informational only, and no vote is required from the board. So I will pause now for any questions.
Any questions for Lynette from board members? Well, hearing none, Lynette, thank you for the presentation of those 2 items this morning.
Thank you, sir.
Continuing on, we do have 1 item for new business this morning, and that is to elect officers for the Board of Community Health to serve for a period of 1 year. And this is stipulated by the board's bylaws. And in accordance, a nominating committee has been in place, and David Cruz is chairman of that committee, along with Cynthia Rucker and Norm Boyd serving on the committee. And David, I would ask you to provide a report to the board.
Thank you, Mr. Chairman. The committee recommends to the board that our current officers continue serving another year. That's Roger Folsom as chairman, Dr. Tommy Hopkins as vice chair, and Dr. Kathleen Ruth as our secretary. And I make that in form of a motion, Mr. Chairman.
Okay, thank you, David, for that report and the motion. So we have a motion to approve this slate of officers. Is there a second to the motion?
Shane Mobley seconds.
Shane Mobley, I seconded the motion. Any further discussion? Hearing none, all those in favor by aye.
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 Opposed, no. Motion carries. Well, on behalf of the slate, I thank each of you for the confidence you placed in us, and we'll endeavor to serve this board to the best of our ability. I don't want to speak for Tommy or Kathleen, so if either of you want to make a comment, please feel free to do so. We're hearing none. We'll continue to move on. Is there any other item of new business anyone's aware of we need to entertain, or does any board member have any comments they wish to make at this time? Well, by the time we have our next meeting, we will have celebrated the 250th anniversary of our country, birthday of our country. So a little ahead of time, I wish all of you a happy Independence Day. As Commissioner Burke stated earlier, you need to get out and vote if you haven't done so. That's an obligation, and right along with our celebrating independence. So it's hand in hand. And I hope all of you have a happy and blessed and enjoyable time celebrating this awesome country. And if there's no other business to conduct, we'll see you on the July 9th board meeting if nothing occurs before then. So all of you have a good day. We stand adjourned. Thank you.
Thank you, Mr. Chairman.
Thank you.
Thank you.
Thank you.